He's a 55-year-old tobacco chewer. CCT neck section showing a heterogeneously enhancing mass in the right half of the tongue, especially involving the base. If you see, there are some post biopsy changes. Already biopsy was taken before sending the patient to us. Normally, ideal situation would have been doing a CT section, CT or an MRI before doing a biopsy would have been preferable choice. So, but this case they have done biopsy and they have sent to us. Here, most important things which you should appreciate is the lingual septum is intact. The lingual septum is intact in this case, and there is the mass is not really destroying the lingual cortex of the mandible. These are the important things which you have to look for staging the tongue carcinoma. And if you see, there are very tiny lymph nodes in the level 1A group and 1B group. None of them appear significant. Most of them have fatty hilum, or they are too small to be considered as metastasis by size at least. As you know, sometimes even a smaller lesions can have metastatic deposits, but however the size criteria doesn't fit. So again, the take home point in this case is the windowing is very important. We have windowed in this case at around minus 50 to minus 100, 100 to 100, not minus, sorry, 100 to 100 level, so that we could appreciate the subtle enhancement of the tongue carcinoma. And you can clearly see the normal intrinsic muscles of tongue are involved. However, the tonsillar fossa is involved, the vallecula is obliterated. So this is a locally aggressive tongue carcinoma. There is no destruction of bone, and there is no the lesion is not causing the lingual septum. Then inferiorly, it is always wise to look at the lung sections to look for any metastasis. Even the bones you have to look for. In this case, we have seen for any there were some paraseptal emphysematous changes. We found a nodule in the superior segment of the lower lobe, which doesn't have any spiculated margins. So this was most probably it can be an infectious nodule. However, follow-up or PET scan is required for further follow-up. What is the condition of the lesion? So biopsy in case of tongue carcinoma, with the take-home lesson about windowing. Sometimes the enhancement you may not be able to pick up if you don't adjust the windows. Have the proper windowing to stage the lesion properly, measure exactly the size of the lesion, so it helps the surgeon to resect the margins of the tumor. Thank you very much.